cover addiction and the role healthcare systems play in the addiction world. In this presentation, I hope to inform you of all the facts that addiction has to offer and to be able to recognize signs if needed. Okay. What is addiction? Addiction is a chronic condition that involves compulsive seeking and taking a substance or performing an activity despite negative or harmful consequences. This is how the Cleveland Clinic defines addiction. What are opioids? Opioids are a class of natural or semi-synthetic or synthetic drugs. This can include prescription or illegal, so anything ranging from cocaine to hydrocodone are included in this. Natural opioids are about the safest opioids that can be taken out of all of these classes. And that is because they are made from seed pods of the opium poppy plant and are considered natural. This includes morphine, codeine, and the synthetic opioids are fentanyl. Those are manufactured entirely in a lab with no natural ingredients and are considered the most dangerous. Semi-synthetic opioids are made in labs chemically processing natural opioids, so it adds a little bit of chemicals. And those ones are the medium class, still dangerous, but not as dangerous as the synthetic. And that can go anywhere from heroin, oxycodone, hydrocodone, all used to treat about the same things. The consequences of using opioids and the effects on the body long term can vary. These are a list, but it is not limited. There's way more possibilities of the effects, but here are some short term. Is constipation effects on physical and mental health, meaning it can cause heart palpitations, it can cause blood sugar droppings, blood sugar going too high, it can cause loss of coordination, breathing problems, speech problems, changes in heart rate, euphoria, dry mouth, nausea, feeling extremely sleepy, or itchiness. Long-term effects are tolerance. This is when the use of a substance is taken for a long period of time and the body needs a higher dose in order to achieve the desired experience for the individual. Dependence happens when a person cannot go without the substance without experiencing some withdrawal symptoms. Withdrawal can begin a few hours after the last dose is taken, and it can interfere with someone's ability to function. So walking, talking, any of those things, withdrawals can affect that. It can even cause death if they use it for a long period of time or overuse it. Some withdrawal symptoms are vomiting, diarrhea, chills, sweating, fever, runny nose, pain in the muscles and bones, changes to pupil size, and so much more. This is an example of a brain. It is just a diagram to show the brain of a healthy person where it lights up when there is dopamine. So in comparison to the meth user of after 1 month of no longer using meth, it is a pretty big difference. Because they are not using meth, that area in the brain is not being lit up as much as a healthy person that has not been using meth. And that is because the meth was creating the dopamine for the brain, so the brain didn't know that it needed to create it anymore. So after the 14 months of no longer using meth, their brain kind of goes a little bit back to normal, but not quite. It's a little more rigidy, but it does get better with time. The signs of addiction may include, but are not limited to, inability to stop, increased tolerance, intense focus on the substance, lack of self-control, withdrawal, lack of emotional response, increased secrecy, so they don't want their family members and stuff to know, so they're hiding more, they're keeping them to themselves more. They might give up their social life, no longer going up to meet with friends or to socialize in any way, failing to fulfill obligations at work or school, or even home, so neglecting their dishes, their home life together, missing deadlines for school and work, using the substance despite knowing it is harmful for them, performing risky behaviors not normally presented. So any sign of, if they used to not do this stuff before, they might start doing it now because they don't care, as long as they are getting the euphoria or that high that they are wanting to experience. Or they experience withdrawal symptoms when the substance has been stopped. The effects of addiction on mental health, pretty big here. Since the substance directly impacts the brain, it interferes with the way the brain is structured and the way the brain functions over time. So going back to that diagram, it will start, using substances will begin to replace the way your body produces the hormones that it needs to produce in order to function. So adrenaline, dopamine, serotonin, all of those stuff, it will start affecting the way it produces that. So it will affect the mental health pretty drastically. If a substance is mixed with a negative consequence, such as financial hardship, job loss, financial relationship loss, anything like that, it can lead to the person feeling anxious or depressed. If there was a pre-existing condition like depression before the substance abuse and then they add the substance use on top of that, it could worsen the condition. It could make the person that is experiencing this more aggravated easily and cause them to act out during minor things that they would normally not act out during. This is because they aren't able to process those feelings the way that they used to, because that drug is, or the substance use of their choice is replacing and like helping them cope with it. So mixing that, they're trying to avoid something but can't do it quite. And this is called a dual diagnosis when there's a pre-existing condition, and it makes treatment plans much harder to come up with, solely because if they already have a pre-existing condition and now they have to treat a substance use disorder, then it could interfere with the way they treat them, just because since they do have that substance use disorder, they can't prescribe anything that can necessarily help them with the first condition. Healthcare professionals are prepared to handle addicts through extensive training. There is specialization in narcology, addiction medicine, outreach programs. There are psychiatric facilities and psychiatric nurses that are prepared to help them. Training for all healthcare professionals are trained to notice the signs of addiction and how to catch it early on if possible. Technology plays a role in preparing professionals for treating addiction because they can use online resources to look up what they don't know. And they're able to reach out to other professionals that are better equipped to help the patient and kind of make that connection for them. It helps with the efficiency of the treatment and provides the ability to diagnose the condition properly. Some of the main indications for opioid prescribing is chronic pain syndrome, back pain, post-surgical pain, palliative care, cancer, or end-of-life care. There has been a history of medications or opioids being prescribed for dental care. It is not realistic now unless they are undergoing surgical care, but it has been done in the past. Treatment programs or options for patients going through the substance use disorder can go anywhere from medical detox. That's when they use medications to help offset any withdrawal symptoms that the patient might be experiencing when coming off of the drug. Inpatient residential dives into treating the root cause of your addiction. So they're living at a facility and they will be going to multiple therapy sessions a day, kind of just figuring out what is the root cause. So it is proven to people with more trauma, childhood trauma, or stressors in life lead to addiction. So that's what they are trying to find the root cause of and trying to help you better manage that in your life so that you can also treat the substance use. The intensive outpatient teaches patients how to be independent and offers therapy sessions. So they're teaching people how life will be without the substance use and how they can independently live by themselves. Outpatient just teaches them how to balance life and recovery. So sometimes people do all four of these. There's much more programs, but these are the most commonly used. There's also a MAT program, that is a medication assisted treatment. It is a use of combination of medication and therapy to treat substance use. Mainly uses about Subutex or Suboxone is the generic. And they go through like a group setting therapy session, and then they also do a one-on-one session, and that offers a better understanding of them. In conclusion, healthcare professionals play a big role in addiction, whether good or bad. Some people have involvement in it, and it is very important to offer trainings and learning opportunities for healthcare professionals to stay up with all the services that there is to offer and how they may assist a person in need. I just wanted to add this hotline information if anybody would need that. The significance of this presentation is just to provide information about an ongoing crisis. We are in what is considered an opioid epidemic, and we have an increase of death rates due to overdose on opioids. To help lower the stigma around addiction and to help people find the empathy for other people struggling with addiction. Some people might think that it's just in their heads and they need to just quit, but it is not that easy for some people. This presentation is also to help provide the basic information that can possibly help identify if a loved one around you is struggling with addiction and how you can help them get the help they may need. This is my works cited page. Nothing too important on here. And that is the end. Thank you.